we're going to talk now about the wings or not the wings. Mr. Shakespeare is not there, but is it the question? Wings or not wings?
I think wings are good.
Can you explain us why is it good?
Well, firstly, when placing the catheters, there's something to stabilize the catheter with. You don't need to touch the catheter as close to the injection areas, which is good for hygiene, of course. And then I find after we tape the catheter in, it's more stable on the leg. It doesn't twist and turn as much. So they're the main reasons. We don't suture catheters in very often in our clinic, but obviously for that purpose, it's important to have wings as well.
What about you, Petra?
See, we don't really use winged catheters at all in England, and I think that is just out of habit. So that would definitely be something to consider.
And what about you, Maxime?
So we use wings because I think that we are trained by using wings, and I think that when you're in school and trained to use that, you don't want to lose these habits because you think you'll start again from nothing. So that's the difficult thing. The second one is that in emergency and critical care, venous access are critical to our patient, and there is no way we can take any risk of losing this access because sometimes we have only one shot on one vein and nothing else more. So having wings, we put sutures, and so we don't have catheter moving because we have wire and not only bandage or anything. It's wired first, and so by that it's highly secured because there's no other option. We can lose it. But depending on practice, I do think that for general practice with short-term catheter, it's not as important. But probably for emergency and critically ill patient, maybe this option is very important to consider depending on how and the way it works.
Before recording, we were talking about wings and not wings. And Maxime, you tell me one day that it's like driving on the left or driving on the right. You can choose, but it's better to know how to drive on the left side, and it's better to know to drive on the right side. Do you agree with that?
Yeah, definitely.
I think for the catheter that don't have wings, you just need to have a very good secure way. And if you have a good practical with good people knowing the way to secure this catheter, there's no issue. But I think it's a little bit more challenging for young nurse or young vet to learn that because it's difficult, I think, to secure it rapidly and correctly. But I think that once you're very good to that, there is no specific issue. And as you said, Nathalie, you should drive on the left if you're in France, but you should drive on the right if you in England. It would have trouble. So you just have to take care of where you are, I think.
Do you share the same idea, Lee?
Yeah, absolutely. I mean, I worked in England for 5 years and went from no wings to wings, and it took me probably about a year before I wasn't, swearing every time I was putting a catheter in because I didn't know what to do with the wings. I didn't know how to hold them. So, but with practice, after about 6-7 years in Sweden as well, I think, the conclusion is probably that I find wings easier in the end. But yeah, you do what you're comfortable with first.
I'm sure we answer the question without Mr. Shakespeare, so it's good.